And in continued COVID coverage, Pfizer has started testing the COVID-19 vaccine on pregnant women. 4,000 volunteers will participate in an international study to evaluate the safety and effectiveness of the vaccine. The study will test healthy pregnant women who are 18 and older. Now, each expecting mom will be given 2 shots 21 days apart. Pregnant women were originally excluded from large U.S. trials for emergency use authorization. Pregnant women have a higher risk of developing severe illness from COVID-19. And joining us to discuss the latest developments with the COVID-19 vaccine is our Chief Medical Editor, Dr. Corey Hebert. Thank you for joining us, Dr. Hebert. It's always a pleasure having you.
Good to see you today.
Now, what do we know, or not know, better yet, about this vaccine and its effectiveness for pregnant women?
Well, we know a decent amount because even though in the initial studies for Pfizer and Moderna, there weren't pregnant women that were initially put in the study. However, some women did get pregnant during the study. So nothing actually happened to the woman or the child after the child was born. There was no side effect profile that we knew. There was obviously no birth defects or anything like that. So we do know a decent amount. It's just that the number of women that were in the study that became pregnant was not high enough for us to really be able to say we can make a definitive diagnosis or a definitive decision on whether it is 100% safe or not. And nothing is 100% safe, just to be very transparent and clear. So what we're doing now is you're looking at women that are at a certain gestational age, and we're looking at it all over the world. We have Chile, Argentina, Spain, UK, all over. And so we're looking at how, and those are the places that have some of these variants that we're talking about. We're looking at the women and seeing if they're going to have any side effects from this vaccine, as well as to see, how does it fare for the baby? How does it fare? Are there any other teratogenic effects, meaning anything that would make the baby not fare as well? And I think that this is a very important group because even though nobody likes to do studies on pregnant women, nobody likes to do studies on children or pregnant women. However, if we want it to know that it is safe, we have no choice but to do the vaccine trials. And then it's the women that step up to do this. I commend them. Super women is what I call them, because somebody's got to do it for the rest of us to be able to feel safe to do it.
Absolutely. And is it too soon to discuss any long-term, short-term side effects on the mother and the baby?
Yeah, well, we're going to be looking at this for about 10 months. All right. So it's a 10-month trial. So we're going to be looking at, to be able to get an emergency use authorization, you really got to look at it for at least 7 to 10 months. But this trial should, just like the Pfizer Moderna trials, are going to be going on until 2022. You remember, these vaccines got emergency use authorization because of the nature of COVID. So these studies don't stop when they get the emergency use authorization. They keep going. So this study will also be able to keep going so that we can have some long-term effects that we can document.
And Dr. Hebert, we probably have about 40 seconds at this point, but health officials have also recommended that some women in high-risk professions take the COVID vaccine even without proof that it's safe for them. Why was that advisable?
Well, because what we do know is that this can be devastating to a person. What we don't know is how devastating it can be to a person with a child, or a person that is expecting a child, or a person that is wanting to expect a child. So we need to be very careful about this. So if you're high risk, you need to go ahead and get into one of the studies to see, so we can actually know what will happen. And without people doing this, we won't be able to get the emergency use authorization. The people that are getting vaccine right now are all getting it, and this across the country, because other people had to step up and become a person that's in a clinical trial.
Dr. Hebert, always a pleasure. Thank you, sir, for joining us this afternoon, and we look forward to having you on again.
Thank you. Have a great day.
You as well. And NASA's Perseverance rover successfully lands on Mars. After this break, BNC gives you an update on the historic mission. We'll be right back after this short break with more.